We will send an invitation. Doctor. Hello, everyone. Welcome to the Yoga Corner. We'll get started here in just a second. Oh, actually. Everyone, I'm so glad to be back on Yoga Corner Chats. It's been a while. Today, we are going to be joined by my new friend, Dr. Al, also known as Allie. Hello, welcome.
Hello. Thank you so much.
I'm so excited. First interview of 2023. So Dr. Al is a chiropractic doctor who assists others to be their authentic self and reduce stress and tension. And she's the owner of Shifting Tides Chiropractic and Wellness. Is that in Exeter?
Yeah.
Awesome. Yes, in Exeter, New Hampshire, where she uses chiropractic techniques such as NetworkSpinal to help her clients find joy and ease. And today we're going to be chatting about neurologic and energetic healing through chiropractic. So we'll get into what all of that means in a minute. But right now, I'd just like to welcome Allie. Thank you for joining us again. I really appreciate you taking the time.
Well, thank you so much, Shelby. It is such an honor to be welcomed onto your page for a live, and especially when you do such a cool series. So thank you.
Of course. So I like to start all of my interviews with just a couple of grounding breaths to calm our nervous system. And I invite anyone who's listening now or to the replay to take a moment with us to breathe. Would you like to join me in a couple breaths?
Yes, please.
All right. If it feels safe for you to close your eyes or just take a soft gaze, settle into whatever surface you're sitting on. Roll your shoulders up to your ears and then allow them to drop down your spine. Take a deep breath, inhaling through your nose, filling your belly, expanding your rib cage, filling to your collarbone, and then sighing it out your mouth. Another deep breath in through the nose, filling all the way down to the belly, and getting empty. One last deep breath together. Inhale, maybe even the biggest breath of the day. And let it go. Whenever you feel ready to open your eyes and come back into the present moment. So I'd like to start by just having you introduce yourself and your business.
Awesome. Thank you. So like you said, my name is Allie. I like to go by Dr. Al. I think it's fun. My other page is Dr. Al, your Chiro Pal, which, just inspires me to keep things light and to keep things easy. So I created Shifting Tides. Part of it is just being in the seacoast, and we work, like we've talked, like you mentioned, with neurologic and energetic healing. So we're really helping people to shift these tides in their lives. Yeah. So like you don't have to be stuck in these rhythms that you think are just the way you're supposed to be. Yeah. So we're right in downtown Exeter, right on Water Street. I love the location because we overlook the river, which just felt so perfect. Yeah. We get to watch the tides come in and out every single day.
Yeah, anyone who's not from this area, Exeter, New Hampshire is like a really cute, like classic New England town right on a river really close to the ocean. That's where I grew up. Are you from the Exeter area too, Allie?
That's so cool. No, I'm actually from Western Massachusetts.
Oh,
My husband is from the Newmarket, actually.
All right.
So that's what brought us over here.
So I want to start really basic. What does the chiropractor do?
Wow.
That's a really big question.
Right? Like, what does a yoga teacher do? You don't just teach yoga, right?
So true.
While we our primary goal, especially with the technique I do, is to align your nervous system. So I'm not just pushing bones back into place or racking and cracking like the traditional chiropractic. We're really helping the body learn new strategies to unwind tension so that you can live as your optimal being. So we cover a lot of different.
That's why I was so attracted to your business, because I never thought of a chiropractor as someone who could help you with your nervous system or with trauma.
Yes, and I love that trauma was something that you were interested in too, because it's a huge reason why people avoid seeing traditional chiropractors.
Yeah.
They have fear around that snap, crackle, pop.
Yeah.
But also, if you have been through trauma, whether it was physical trauma like an accident or a slip and fall, or mental and emotional trauma as well, it's hard for your body to receive an adjustment.
Yeah.
Definitely. So this technique starts with the very base foundation of your nervous system. And without getting into too many details about the technique itself, we're just teaching your body to unwind this tension, because your brain runs the whole body of your show.
Yeah.
It has your spinal cord, and every single nerve comes out from there. And it goes to every organ, every cell.
Right.
So if we start with the nervous system and get it to relax, it actually causes the other parts of your body to relax too.
Yeah.
So if we have a bone that's out of alignment, twisted in your spine, the muscles actually had to move that bone to that position. And the muscle did that because the brain told it to.
Right.
For whatever reason, there's a magnitude of reasons why that might happen. But when we can relax the nervous system, the brain goes, oh, wait, that doesn't have to be that way anymore. And the muscle relaxes. And then that bone moves back into place on its own.
Wow.
So we call it reorganizational healing, because we're not just getting you back to where you were. We're teaching the body new strategies so that you are going to be like next level, like upgrade.
Yeah. So I think you might be a really good person to ask, how are the body and the mind connected, and how does that like affect your nervous system?
Oh my gosh, they are so intertwined. We think of our body, we think that we are such physical beings, which we are, but there's so much more to us. We just get so caught in what our body's doing, when our body's doing it, what makes our body feel this way, right? And even our thoughts happen outside of our body. There's an interface where our thoughts are out here in the field, the space between you and me, the space between me and this plant.
Right.
We're out here in the field, and we have to interpret those thoughts in our mind.
Right.
So when we're going through different things, when we're experiencing things with different types of people, people who have more trauma, people who have less trauma, people who have more energy or less energy, it's going to affect even those thoughts that we have. So a big piece of trauma getting stuck in the body, and remember, trauma can be from that physical, that mental, that emotional, or even chemical too.
Right.
Our body gets to a point where it's almost overwhelmed, and it can't adapt anymore. And so I like to say, we'll think about that later. We'll worry about that another time. But in reality, it's a very amazing strategy that our bodies have, because if we got to this place of overwhelm, we would melt down.
Right.
And no one likes to feel overwhelmed. And if you've ever been really pushed to the brink of overwhelm, it's not a good place for your body, your mind, your soul. Nothing. Yeah. So when we're at that point and our body pushes these things away, we momentarily feel better, because you're like, I'm just not even going to think about it. I'm not even going to worry about it anymore. But we still had to experience that.
Right.
So those pieces get stuck in our body. Mm-hmm. So if you have that spot when you get really stressed, you're like, oh yeah, I carry my tension right here. You know? Or maybe it's your low back.
Right.
It's all of those repeated traumas are being built up and stored there. And that one could be the straw that breaks the camel's back.
Yeah.
Or it's just a reminder of like, hey, there's some stuff we haven't dealt with.
Right.
Does that answer your question?
Yes, absolutely. And I think to piggyback off of that explanation, because this was information that was like, or my understanding of trauma has changed a lot, like over the past year even. And I think a lot of people hear the word trauma and they think like of a like capital T trauma, you know? But it can be, it's such a bigger term than that. So could you define, like, how do you define trauma when working with your patients?
I think it more comes down to the patient defining trauma for themselves.
Yeah.
You know, because some of us have that bar where something really bad happened to us.
Yeah.
Whether it was abuse, you know, mental, emotional, physical, sexual. Oh, that is a bar, you know. Maybe your trauma was a slip and fall on an icy patch, and now you're just like fear of the snow.
Right.
Maybe your trauma was having a parent that was so controlling that you never had the ability to think for yourself. Right. And now when you have to make a decision, it's traumatic.
Right.
So I guess trauma to me comes down to a point of overwhelm. Yeah. It comes down to that I'm unable to deal with this at this moment, and I can't process this completely at this time.
Yeah. And I think also what was eye-opening for me is that when you think of childhood trauma, you have to think about what is overwhelming to a child.
Yeah.
Right? Like, because you might look back on things in your childhood and say, oh, I didn't have any, everything was fine and perfect. But maybe there was something that happened for 4-year-old you that was like really overwhelming. You know what I mean?
Definitely. We imprint most of our rules, if not all of them, from age 0 to 7. 0 to 7 is what we like still live our life as. And if you don't go back and like dig through that stuff, you're in the I have to make my bed when I wake up or I'm a bad person. You know, like I have to eat all the food on my plate or else other people are starving.
Right.
You know? And like of course there's some truth to those things. And we don't want to eat to the point where we're over full. You know, if we have a busy morning and we don't make our bed, it's not the end of the world.
Right.
And even
we
like,
are like
people pleasing. Oh, that's the biggest one. Like, be a good girl. Like, be a good boy. You know,
nice.
I love like what you're coming into that this 2023, like the fire that you have. I'm like, yes, we need to rewrite these stories. We need to be our authentic selves if we really want to thrive in this lifetime.
Yeah. And it's like something you have to practice because since you were 7 or 5, like you've been doing this and it's awkward at first.
Oh, yes. Oh, yes. I still have trouble putting myself out there.
So how can someone who is, you know, maybe has a dysregulated nervous system or is having something in their body that might be connected to trauma or their nervous system, like how do you kind of like, what's the process of working with you in that way?
Well, the cool part about NetworkSpinal is we don't have to figure anything out.
Love it.
We don't have to have this like in-depth like therapy conversation about what you're going through.
Yep.
We analyze the body the same every visit from head to toe, literally. And we look for these tension patterns that are representing right then and there. We're like an onion. So like we're just peeling off the layers.
Yeah.
So I don't focus on pain. I'm definitely am understanding of your pain and I want to know when it's shifting and changing.
Yeah.
And it's not our focus. Our focus is regulating your nervous system so that your body can function as it's meant to. And the side effects of that are reduction in pain and so many other things too.
Right.
It really is a symptom. You know, the pain is the symptom of the trauma that's stored or the emotional experience that you didn't understand, you know?
Yes. And I think that is something that's missing for most healthcare providers. Like, I feel like, at least in my experience, oftentimes I go to someone with pain and it's almost, whether it's emotional pain or physical pain, and it's like, well, here's like a fix it now kind of solution.
Yeah. The Band-Aids,
Yes.
fixing the symptoms instead of diving into the root cause of what's going on.
Exactly.
Which is like the premise of chiropractic. If we start with the brain and the nervous system,
Right.
domino effect, everything else will work itself out. But if you're just treating the pain, and if I have you stop coming in as soon as the pain is gone,
right,
guess
what? It's gonna come back. Right. And there's we'll take this pill solution, which is valid in a lot of ways, but also that can lead to another whole slew of problems that next thing you know, you don't know what's the pill and what's the problem.
Yeah, because every medication has side effects.
Yep.
I've talked about that chemical trauma,
right.
That's tension that gets built up. So the first thing we do when we take a medication is heal from the medication.
Right.
And then the medication can do its work.
Right.
And like you said, sometimes medications are necessary. Sometimes they're just necessary for a short period of time while we can figure out that root cause. Let's treat these symptoms because this is a really severe situation and I'm really uncomfortable, and modern medicine is amazing.
Right.
And we don't want to be on a medication for the rest of our life.
Right.
If you're put on a medication, it's like, okay, how can I get off of it now?
Right. Right. I feel, at least for myself, that I wasn't aware how dysregulated my nervous system was until I started healing it. I started doing yoga, and that kind of started to put the pieces of my mind body connection, and I worked from there. But I'm not sure if I would have recognized the symptoms or patterns of burnout or my nervous system needing attention. What might be a reason or a cause for someone to call you and say, I need some help regulating my nervous system? Or
unfortunately, most of us are exactly like that. We don't realize hey, I've got just a little bit of tension built up here. I'm going to do something about it.
Right.
We wait until there is this severe thing. I can't turn my neck anymore.
Right.
I can't look when I stop at a stop sign. I can't look to the left to check the road. Right. Or for me, it was my low back pain got so bad, it would cause my knees to buckle. Ugh. I was in high school and I couldn't even stand up anymore. Gosh. So it usually is this severe situation or chronic situation that causes someone to come through my door.
Right.
But I believe if we had more awareness of the fact that our nervous system is running the show, and the fact that, pain is the sixth thing that happens in the body when there is an interference in the nervous system. Your
brain come on.
Yes, it's hey, do you see what's going on? Red flags all over the place. So I'm right there with you. I wish that we had better markers to help people understand. I think anxiety is one of the huge ones.
Yeah.
Headaches, huge one.
Yeah.
If you have one of those two things, your nervous system isn't coordinating the way it should be.
Right.
And it's not your fault.
Right.
It's not your fault, and there's nothing wrong with you. There's just areas that you could improve.
Right. And I think it goes to say just to not ignore it's easier said than done, but those little messages, right? Your body is giving you, being curious about what that means.
Definitely. Yeah. But so many of us are disconnected from our bodies too. Right. And we also live in America, which just makes it tougher. It's don't worry about that later. You got to get to work.
Right.
Worry about that later. You got bills to pay. You don't have time to go to yoga class. You got to go home and make dinner,
I saw this play out on the football game. I don't know if you follow football at all. I don't, but I just happened to be watching that game, one of 10 football games I've ever watched. And, this guy is on the field and this like really like tragic thing is happening, and then they're like, well, just like play football in 10 minutes.
I know.
And I'm like, that is just like a on-screen representation of like what happens all over the country in like most workplaces, you know.
Such a good example. I didn't think about it that way, and it was such a tragedy. And of course, we hope that he heals and gets better and finds the care that he truly needs. But you're right. The fact that they were just going to throw all of those men back on the field, and I think it's another layer of, you know, men don't have feelings.
Yeah.
You know, if it was women, they probably would have like, all right, everybody out of here, game
Right.
over, like right away.
Yes.
And that's a tragedy in itself, because of course the men feel every emotion that we do, and they're just not given the permission to show those feelings. And talk about tension and stress and trauma.
Right. One of the journalists was trying to like narrate the situation, which was probably really awkward, but she kept saying, and they're openly weeping. And I was like, yeah, no shit. Like, I'm openly weeping. Like, of course. Why is this a shock to us?
It's too bad. But we definitely need to take more time to listen to our body. Yoga is a beautiful example of that, of really checking in and becoming a piece of yourself again. Not running 10 steps in the future or living 5 steps in the past, but really just like being present and embodying yourself.
Right.
I think meditation is another such a powerful tool that so many people don't even bother trying.
Right.
Because they think I have to sit here in silence and nothing can come into my head, and that's how it has to be, and I can't do that, so I can't do meditation.
No one can do it. You don't have to be empty.
Yeah, exactly. But we can use that time to just be present with ourselves.
Yes.
You know, to connect to ourselves and not worry about the laundry list of things that we think we should be doing.
I'm curious if you would want to share any of your journey of wellness or coming to be an entrepreneur.
I would love to. My journey of wellness is really what helped me find NetworkSpinal. There are hundreds of chiropractic techniques, but we all think of like the same two. They either like snap your neck or lay you down on a table and crack your whole spine.
Right.
And so I had mentioned when I was in high school, I had this debilitating low back pain.
Yeah.
And I went to my medical doctor, and they just kept putting me on muscle relaxers and telling me to rest. And even then, like as this 15-year-old girl, I was like, this isn't going to help the problem.
It can't be the rest of my life.
Like, okay, but what happens after this, right? So I didn't get better. I kept getting worse. And I saw a chiropractor who did the snap, crackle, pop thing, and no education. And I left thinking that guy was crazy. You know, like this didn't help me. I don't feel better.
Right.
And, you know, if there was more education there, I'm sure it would have been a different experience, right?
So he didn't really tell you why he was doing what he was doing or like what was going on.
Exactly. I felt manipulated, which is what we'll call a lot of these adjustments, manipulation. So then it got worse, and I ended up seeing a different chiropractor who did a different technique. He happened to use an instrument, but he took this tonal approach. So he looked at my whole body. He looked at the tension patterns, and he used ligaments in specific spots to help my body unwind that tension. Yeah. And I remember standing up from his table, standing up straight for the first time in months. When you're thinking, this is how I'm going to help people. Right? At this point, I'm 16. Like, this was a journey. But realizing right then and there, like, this is how I'm going to help people. I'm going to be a great chiropractor. I love that. So fast forward to chiro school, I thought that was the technique I was going to do. Right. It's called the activator technique. I still really enjoy it. And I was lucky enough to find NetworkSpinal. It's like, to me, the next level of chiropractic, because we're starting at the tension patterns at the spine, but we're focusing completely on the nervous system and the neurology there. So we're not just starting with tension patterns and then adjusting bones.
Right.
We're completely working with the brain.
Yep.
So at some point you kind of leave the realm of chiropractic and we're
Right.
in this like upper mind game where it's so powerful for entrepreneurs because it helps your brain be more clear. It helps your decisions be easier.
Yep.
You know, it helps you hold different perspectives like all at one time, which is what we need to do when you're working with different people, right?
Yep.
So as soon as I learned the science behind this technique, because a lot of people will think it's woo-woo, like it's energy work, it's different.
Right.
But there's so much science that goes into it. I was just all in. Yeah. And then I had my own experiences being adjusted in chiropractic school manually. And I got sick. You know, the trauma I had in my body wouldn't let me receive those adjustments. Right. You know, it put me into defense. I got every single cold that came through the school, which is the opposite of what chiropractic should do for you. Right. And, you know, once I made the switch to tonal adjusting and NetworkSpinal, my whole life changed. You know, I barely get sick anymore. My husband will come home, like he had the flu a few weeks ago, like I got a headache, you know? So it's just like when we're upgrading the nervous system, everything works better. And for some people, that snap, crackle, pop, it works great for them. So don't get me wrong. Chiropractic care is better than no chiropractic care. But for me and for so many others, that just doesn't serve us. Right. I'm sure it's the same with different yoga techniques. Like some of them, I can't be in the headspace for that. But this I can enjoy.
Yeah, and I think that is important because we are all different, and you know, if you try something and it doesn't work for you, like that's not the end of the road. As long as you keep being curious and like willing to do the work.
Yes. I mean, if you go to a medical doctor and you don't like them, you're not like, all right, I'm never seeing a doctor again.
Right. Yeah.
You know, you find someone, you ask people, like, who do they enjoy working with? Right. You know, and you find a different alternative. Yeah. Even second opinions, like you're looking into other doctors to see if their opinion just more connects with you.
Yeah, I think that's important. I have said this a few times to people in my life, like, you are the customer and like you can find a doctor or a provider that like you enjoy working with, or like, you know, like makes you feel good and comfortable. Like you don't have to receive like abuse or like feel uncomfortable with your doctor.
And you don't have to commit to someone who you just met. You don't have to commit to someone maybe it's your pediatrician and they transfer you and you're still able to work with them the rest of your life. Like, amazing that they know you. And we all grow and shift and change. Yeah. Just because it was good for you then doesn't mean it's the right fit for you now.
Right. Is there anything else that you would like to share about your services or what you do in your business?
I also love working with pregnant mamas.
Yeah, it says it on your profile.
Yes, so I didn't really mention my entrepreneur journey, sorry.
Oh, really, that's right. Feel free to share more.
But I've worked with a few different chiropractors, and you know, I never felt like I could be my authentic self within the business setting. And, you know, that was really important to me because I want the people coming through the door to be able to represent their authentic self, because the more we disconnect, the more trauma we have, the more we disconnect, and the more we just try to fit in the box. You know, we're just trying to survive. So I didn't feel like I was being me, so how could they be them? Right. So one thing I did after leaving my last associate position was I did maternity coverage for one of my friends, and she had a huge pregnancy population. So there's a specific technique that we do with pregnant women. It's called the Webster technique. And it also uses this tonal approach. So I'll do a NetworkSpinal entrainment. We don't call them adjustments always. We also call it an entrainment because we're entraining those different levels of your body, of your being. So then we move into a Webster adjustment, which is also so gentle. And it's literally specific for mothers carrying babies. So it helps the pelvis be more aligned. Ooh. So that baby can sit how it's supposed to.
Right.
And we can take pressure off places. Yeah, we don't want pressure in places that it doesn't need to be, right. Like your sciatic nerve.
Right.
You know, and we don't want baby in a position where it's so crunched up, it's kicking on your ribs, right. While at the same time elbowing your bladder, you know.
Right.
So I love helping pregnant moms find this relief. There's so many women who go through pregnancy thinking that it has to be awful and uncomfortable, and it's just the way it is. And it's just not true. It's just not true. I mean, sometimes it's uncomfortable, don't get me wrong. Like, you're growing a human. Right. Especially at the end there when you got a whole watermelon. But we really can maximize that space. Yep. I mean, there's so many hormones, such as relaxin, that literally causes your ligaments to relax. So instead of your joints being nice and tight, they're made to stretch. And it's so important because how could you give birth if you didn't have some stretch?
Right.
But at the same time, when you're sitting on the couch, those muscles are those ligaments will start to pull apart.
Right.
So those bones are moving into uncomfortable positions based on how we're sitting and how we're living our life. Right. Yeah. So if we don't have something to check them, they just get more and more pushed around and out of alignment. So that's my other passion in the office, is helping mamas find comfort and ease, let alone de-stressing.
That makes me think of a question, which is, I have read about how the mother's nervous system can affect the baby's nervous system. I was like, wow, that's fascinating. Can this technique you're talking about, or anything else you can do for pregnant mamas, help, like, affect that or change that?
Yeah, I mean, your body is literally creating their body. Right. Even though they're kind of running the show in there and they're doing what they need to do, your nervous system's feeding them until, like, their birth and that placenta's out too. Right. So we especially talk about stress with mamas. Like, you can't stress if your baby will be stressed.
Right.
And that makes you stress more.
Right. You're coming out stressed about that.
So, of course, if we can get their nervous system into a more relaxed space, it's that domino effect again. It's going to allow that baby to have more ease, and it's going to allow your systems to communicate in a better way.
Right.
I've also seen, like, moms get entrained and their bellies. So we call it an entrainment because our nervous system affects those around us.
Right.
Just like we talked at that energy state. So I've seen moms get entrained and then their bellies are flipping around because their baby is also entraining at the same time. As they release tension, their baby's like, oh, maybe I should release that tension too.
Right. You know, the more I learn about just, like, energy and like how our energies affect other people, and, you know, a lot of people feel like it is woo, but the more I learn about it, like, from these perspectives, I'm like, dude, that is it's like, so it's science. It is there. Like,
yes. It's these ancient, like, they've known about this forever, you know, just as, like, this medical model has grown, we've kind of forgotten about everything else.
Right.
But yes, like, there's so many layers to our being, and, you know, they're even finding muscle theory that there's an electric synapse isn't true. Like, it's still a theory. They think it's more founded on tone.
Wow.
So if we can correct the tone of the nervous system, like, holy cow, your muscles can work better too. Like, it's this whole cascade of effects.
Yeah, that's really fascinating, and I think it's really special to have you in this area, especially because I'm from Exeter, so I'm feeling especially grateful because I don't think that there's enough providers, doctors, practitioners who are blending both models.
Yeah.
Oh, thank you.
Thank you. I love that you're from Exeter. I did not know that. And it just makes this full circle even better.
Yes, we can grab coffee sometime. We'll message about that.
That sounds so
that would be really great.
That sounds so good.
Before we end this, I'm just curious, how can people find you? How can people make an appointment?
So Instagram's one avenue. You can message me here and we can set something up to schedule. You can also message me through my website, which is shiftingtidesnh.com. And yeah, you're going to be talking with me. It's just me in the office right now.
Awesome.
So yeah, we'll get to connect right away from day one.
Cool.
You can also call or text me. I have a phone number, but you can find that in my information also.
Perfect. Well, this was a really fun conversation, and I feel like I could keep you here for like 2 hours. But I appreciate your time and everything that you shared here. Thank you so much.
Oh, thank you.
I'm going to post this on my page in a few minutes here. I'll make you a collaborator. And anyone who's watching, thank you for joining us. If you have any questions or curious, make sure you follow Dr. Al and Shifting Tides, and I'll tag all of that on here so you can find them very easily. And everyone enjoy the rest of your Thursday.
Thank you so much, Shelby.
Bye.
Yes, have a great day, everyone.
Bye.